Hello, everyone. Thank you so much for joining me, Dr. Noah Erickson from Innovative Family Wellness, as I talk about natural treatments for Lyme. You know, I see many patients and have now for the past 15 years with many of the common Lyme symptoms. And you might first of all ask, wait a minute, how do I know if I have this? So let me see if I can connect with you here with these top 5 symptoms that are reported to me from patients with Lyme disease. Number 1, fatigue. Anyone out there? Yes, maybe. Number 2, short-term memory loss, what I call walking into the room and going, what the heck am I doing here? Number 3, joint pain or swelling. I'm sure people can relate to that, right? But we'll kind of sift through that and how to distinguish if that's Lyme. Number 4 here, tingling, numbness, or burning, what you call paresthesias. And we're not talking about those folks who are diabetic. We're not talking about the folks who have neuropathy for other medical conditions. It's a type that is instituted from the bug kind of burrowing itself into the peripheral nervous system. And number 5, disturbed sleep. How about the people who say I don't fall asleep? Or I fall asleep great and I wake up? Or what about the people that said I can sleep all day long and nothing happens in the morning? I still feel like a truck ran me over, okay? So what can we do? Again, identifying those 5, hopefully you can connect. I personally had Lyme disease years ago, so I can tell you for me at the onset, I did see the tick. I was one of the few lucky ones that also had the bullseye rash. Many people though don't. So that might be you. So first of all, Mythbuster 1, to have Lyme, you may have never seen the erythematous rash called the bullseye rash. Number 2, you may have been born with it. We know that maternal Lyme is possible. So think this way, you may never had a tick at all. Number 3, there's things called co-infections like Bartonella and Babesia, and they can come from other animals, right? Who hasn't nuzzled with their kitty cat or their dog? Do you know that they can carry some of these germs and worms like parasites? So keep in mind, it doesn't even have to be something obvious. All right, so let's say now you can identify me. We said fatigue, memory loss, joint pain, numbness, disturbed sleep. Let's look what we can do naturally. Number 1 here, if you have fatigue, we always tell people we have to treat the whole person. It is so important with Lyme disease to look at signals. Whenever your system's stressed, you're outputting a ton of cortisol and you're pumping out glucocorticoids, ultimately causing more inflammation through a crazy pathway called insulin. So we first of all have to say, when you're tired, what are your adrenals doing? And yes, folks, that does involve something in your brain called the pituitary. And those of you who suffer with this disorder, we ask that critical question, do you have a mold condition, right? When you walk into a basement or your grandma's cellar or an old library, or a room in the house that's kind of like smells like mildew, maybe it's the garage or a crawl space area, the basement, because that can set off a crazy cascade that changes the way that area of your brain works. You can have memory loss, you can have dehydration, you can end up with low sex hormones despite taking things like testosterone and estrogen. So we'll look at the adrenals. We look at the thyroid too, right? Under the influence of high cortisol, your thyroid can do some really funky things, and it can change the way TSH talks to T4. So we have to look at thyroid labs. So do I run labs? Absolutely. We look at adrenal panels, thyroid panels, and that's a neat way to get a handle of things. Keep in mind this too, you can be tired, well, just because you go deficient in vitamins and minerals. A lot of people have a form of Lyme that affects their gastrointestinal system, so they're bloated, they're nauseated, and on top of that, they end up with a yeast infection, because many a times the history includes antibiotics. Maybe you tried something like doxycycline or Ceftin for Lyme disease, but now you're having a residual effect of yeast. So what happens is you're so nauseated, you don't eat, you're not breaking down your foods because you're low in digestive juices and enzymes, and you become depleted. So we look for vitamin B12 levels and folic acid levels, and of course the all-important immune booster, vitamin D. So we can definitely be fatigued from a lot of reasons. All right, let's roll in here now. Symptom number 2 and what we can do to treat this. It's forgetfulness. Remember that old thing where you're wearing your glasses and you walk into a room and you can't remember they're on your head, or you walk into a room and you're thinking, what in tarnations am I here for? You can have the everyday mental malfunction, right? The sometimers, not Alzheimer's. I used to work in a nursing home. We tease and say we're having a sometimers day where sometimes I remember and sometimes I don't. So people always say, what the heck is that? What happens when your hypothalamus, your amygdala, your thalamus, these brain structures are influenced, you can actually have inflammation in these structures and you do not get proper communication forward to your prefrontal motor cortex. So the synapse in there, the connections kind of become short-circuited, right? It's like the hardwiring is getting a blip or a glitch in there. So what I always tell folks is, let's look at these different levels and let's decide what we can do to help reconnect that. Because your body makes something super cool called brain-derived neurotrophic factor, and oftentimes we put people on very specialized diets, sort of shift them toward ketones, and you can actually start to make that work better. And there's some different vitamins and some different minerals, things like lithium, for example, and phosphatidylserine that actually help to reconnect that pathway. So even if you can't remember a word I said, remember this, that yes, your everyday mental malfunction may not be Alzheimer's. Funny side step here, people bring in their genes, because I do a lot of gene work with MTHFR and their genes, and they'll say, look, I have the gene for Alzheimer's, I'm destined, I'm doomed. And I said, wait a minute, your genes can be dirty, right? They can be infiltrated from infections and things like that. So if you have one of those APO2 or APO4 genes, don't stress, hang tight. It may not be the whole deal, right? So the short-term memory loss, we work a lot inside that brain. Something interesting as a chiropractor and acupuncturist, remember this as well. When we set the neck in alignment, as a chiropractor, you restore proper blood supply and reestablish nerve connections, removing interference from the central nervous system. That actually helps people feel clearer and more focused. A lot of people sleep better. Now, it's not a one-size-fits-all, and I certainly can't tell you that everybody that receives that is that responder, but it's helpful. So I send people home with little ear tacks in their ears and certain points to help them relax, or I'll tell you to go see your chiropractor or massage therapist and get that lymph moving, clear up the interference, and start feeling better. All right, let's take on in here to number 3, the old joint pain. This is something I had, and pay attention to this. If you have rheumatoid arthritis, you might have bilateral knee pain, right? Right pain, left pain, I understand that. But in this condition, hallmark of Lyme and Lyme co-infections, to include Babesia, Anaplasmosis, Bartonella, Rocky Mountain spotted fever, these critters have a way of causing random migrating joint pain. So I'll put this out to you. One day, your left shoulder and elbow are killing you. You can barely do any work around the house. You can barely, function, even use the computer, whatever. You're getting tendonitis in your wrist and hand. A few days later, you feel great. You're ready to jump for the stars. But what's happening at that point is maybe your knee and hip hurt. You can barely get out of bed. You twist to get out of your car. You try to pick up your grandkids, or your kids try to go play sports, and they try to run, and their knee, hips, and ankles are killing them. It's the random migrating joint pain. So what do? We ask ourselves this. Common to these bugs, in particular Bartonella, they love areas of high vascularization, high metabolic activity. So they have an affinity for the joints and the joint tissue. So we use natural anti-inflammatories. Here's what I love to tell you to break out the cookbook. Start to break out the cookbook and use things like ginger tea, right? It has natural anti-inflammatory products. What about substances like onions in them, or apples that has bioflavonoids such as quercetin, which naturally help suppress inflammation? What about when you make a soup, or maybe do some brown rice or some wild rice? You can put in there black pepper and curcumin, which is known as turmeric, and those two together have an anti-inflammatory effect. What about, instead of having all the time red meat or hormone-laden chicken, why not steer more toward fish? Things like sardines or anchovies, right? Maybe do some salmon, some naturally fresh caught, wild, raised salmon. That way you're getting a lot of omega-3s. You can do things like in your smoothies, pop in chia seeds and flax seeds. Those omega-3s suppress inflammation. So core to these conditions is inflammation. So that's huge right there, just understanding that. So I tell people from a diet perspective, that's the way to go. And from our perspective, We have a host of herbs, homeopathics, infrared sauna, chiropractic, acupuncture. So keep in mind, you don't have to come and get all those here. I treat a lot of people that are not from the area, that are from their own hometowns in different states and countries. You can always go and work with your professional there and get those services as an adjunct to suppressing muscular inflammation. So you hook up with a good person who does massage, lymphatic, chiropractic, acupuncture, all things we offer here, and we can help support you on the nutritional end. Herbs and vitamins, I can tell you there's an array of things that we do, but if there's one thing I've learned in 15 years of doing this, go slow. Detox for everybody, or what they call when you use an antibiotic, a Herxheimer reaction, can cause an aggressive response where your body's now more inflamed and more sore. So put the brakes on, go slow, and when you detox, remember, you have to go at the pace of the body. That's where a lot of the genes come in place. People say, hey, I'm not the world's greatest detoxer. So I take a look at your detox genes for glutathione. I look at the pathway of homocysteine and CBS and MTHFR and make sure you're methylating, make sure you're producing glutathione, make sure your kidneys are detoxing and keeping enough of those amino acids present so you don't get cold after you eat, you don't feel peripheral neuropathies, and a whole host of other problems. All right, number 5 here with Lyme. This is the disturbed sleep. And I can't tell you how many people come to me and said, I tried melatonin. I tried a glass of alcohol. I tried GABA. I've tried all these different remedies out there. And they've worked for me for a little bit of time, but now they've stopped. So unfortunately, what happens is our bodies have a disrupted sleep-wake cycle. It's kind of the old thing about using antihistaminics for people who sleep. Just as an aside here, I used to work in a nursing home, and for years I passed sleeping pills. And one day I finally stopped and asked the nurse, what am I giving out? These people seem to love these things. And she laughed and said, it's a secret, don't tell anybody, they're antihistaminics. So what we have to do is work this pathway of getting your body to shut down inflammation, look for histamine-triggered foods, look for histamine that could be in your gut, and work that pathway of shutting down inflammation, right? So that can come in many ways. So interleukins, inflammagens, cytokines, they disrupt the ability to sleep. And here's a cool thought. If your gut makes more brain chemicals like serotonin and melatonin to feel good and get a good night's sleep, but your gut's a hot mess from taking antibiotics or from a crummy diet, wouldn't it make sense that your sleep might be interrupted? Absolutely. So we restore the gut, we put back in the proper vitamins and minerals, we support your adrenals, which have a big role to do with sleep, we shut down inflammation, we look at the acupuncture meridians to make sure they're balanced. There's a whole host of things to getting a good night's sleep. But if I can say something here, shut down the Wi-Fi. I so understand that many of my kids are on there and adults, you know, getting that last email in, or maybe you're playing something fun on your games or something. Put those away. Keep the room temperature down. EMF sensitive people, I was the king of this, and I want to share something with you that I did wrong. I used to lay on an electrical heating blanket when I had Lyme years ago just to get warm. Not a good idea. If you want to preheat your bed, great. When you get in, shut it off. EMF fields, as we know, can allow these bugs, in particular molds and mycotoxins, to go crazy. So shut down the Wi-Fi, try to have the room cooler, but warm enough, because I know a lot of you have the circulatory problems like I did. That's important to understand. Get a good night's sleep, do whatever you have to do. And guys, we have an awesome hemp product here. It's full spectrum hemp that has been working great for children and adults to getting them to rest. It shuts down inflammation. So it's something we're using to get a lot of people to sleep. So I can tell you here, there's lots of remedies. Everyone's unique, just like their fingerprint when it comes to Lyme. So remember, everything from a good night's sleep to proper diet to proper supplementation, lifestyle, and something big for me too. You know, when you're in these troubled times, I understand you think it's the worst thing in the world, and it's probably hard to even hear me say this. But keep in mind, sometimes what you think is an absolute curse can be a blessing. So just stay tuned, stay in with good faith, stay in prayer, stay in your daily devotions, be strong that way, surround yourself with support groups and friends, because you'll need a lot of help during this. There's days you can't get out of bed. There's days you're so brain fogged you can barely even function. I totally understand that. I've been there. There's days where the depression is so deep, you just feel like calling it a day. Hang in there, stay in faith, stay strong, work with people around you who are supported. And if this is something you're suffering with, I would really like the opportunity to see if it's a good fit here, helping you identify, is this Lyme? Because remember, we call this the great masquerader. It's chronic fatigue, right? It's fibromyalgia, it's MS. It's all kind of labels until you finally go testing with the correct labs and the correct methodologies with the correct provocative agents to even get it to show under the presence of a strong immune system to even come up with this diagnosis. And if there's something cool to pass along to everyone out there, if you're just new at this and you're saying, is that me? Is that why I can't sleep? Is that why I have brain fog? Is that why I feel tired? Is that why I hurt? Is that why my rheumatologist diagnosed me with Lyme or autoimmune or MS or fibro or chronic fatigue? There's something here that's interesting. It's a clinical diagnosis. When I went to school years ago, they used to say 90% of what we do to help you as a patient or a client here is to take a good history. So we have to be astute at recognizing, is this Lyme? Is this Babesia? Is it Bartonella? Is it adrenal fatigue? Is it thyroid malfunction? Should we run labs and be astute and put on many different lenses to properly screen you for this condition called Lyme? You know that old saying, it takes one to know one? All I can tell you now in hindsight, what a blessing. Go ahead and laugh at me, but what a blessing that I suffered, because it takes one to know one, and I certainly understand now why the good Lord had me go through this, because I have a great amount of empathy for you. I understand, and it helps me better identify and detect what your symptoms mean versus what you get back on paper, right? So I always say this too, treat the person, not the paper. Their story, their words. A lot of you know I work with children with autism. We're identifying more and more that a lot of these kids have maternal-induced Lyme. They're carriers of Babesia, Bartonella, and co-infections. They're living in moldy conditions unbeknownst to the parents. And this whole big compilation is destroying their immune system. So we support the immune system. We fortify the diet. We re-nourish the body. We look at all of these areas with a very good in-depth history. And then we can help you with, what were they again? Number one, signs and symptoms of Lyme. To reiterate, fatigue. Number two, brain fog, short-term memory loss. Number three, the joint pain, the random migrating pains and the muscle aches. Number four, the paresthesias, right? I have neuropathy, numbness, tingling, burning for no apparent reason, what they call idiopathic neuropathy. Number five, those sleep problems. So keep all those in mind. If this has been helpful for you, or you know somebody you think might have this condition called Lyme and Lyme co-infection, spread the word, hit the like button, please hit the share button to them, send this onward to them. I would really like to hope and think this can be helpful. And always reach out to us here. We're Innovative Family Wellness. We treat both children and adults. We have a special practice for special kiddos called Dr. Noah's Ark. That's a great thing. Check us out online. It's innovativefamilywellness.com. Check us out on Facebook too. Thanks everyone for watching. I sincerely hope this has been helpful. And if we can be of help to you, we'd be honored to also be part of your healthcare journey. For Innovative Family Wellness, this is Dr. Noah Erickson wishing you a great day.